Hello and welcome back to our morning news starting point. Still with me, Stephanie Silitonga.
And I'm Sesko Satrio. And we're going to talk about the sleeping disorders that we've talked about early on. And we know that sleeping is something that is very important for us, but sometimes it is, maybe we can say, misunderstood or maybe overlooked. And we're going to talk about that with our special guest doctor, Dr. Andreas Prasaja, a leading registered polysomnographic technologist. Welcome, doctor. Good morning. Thank you
Good
for
morning.
joining us. Well,
Hello.
doctor, well, let's dive into the topic this morning. Sleeping. Everybody needs sleep. It's important part of our life, of every human. But what I want to know is, maybe we are not, a lot of people are not well informed about sleeping quality or maybe sleeping disorders. So can you tell us, what is the most common types of sleeping disorders that you found maybe in your clinic?
Interesting. Most people think that the most common sleep disorder is insomnia. But interestingly, the ones who came to my clinics actually are hypersomniac. Hypersomniac. So
Okay.
those are the people who are sleepy all the time.
Okay.
So we call it also excessive daytime sleepiness.
Right. That's a common.
Also, not just at night getting tired or sleepy, but all day.
So they don't have problem sleeping at night at all.
Okay,
Alright.
okay.
But they have problem waking up.
Oh, okay.
So in my clinic it's usual to have in the waiting room people are because they are sleepy.
Well, in my common knowledge, I've heard that if one person is always sleepy, that one person has a lot of sugar inside
Loaded,
their
yes.
body.
Yeah,
Is
yeah,
it
yeah.
true? I mean, it's
Or
too
those,
much. Or
yes,
it's too much.
or those with diabetic.
Kind of
diagnosis
true
diabetic.
because science been proving that sleepiness will induce sugar level.
Okay.
So you will have high sugar level if you are sleepy all the time.
Oh,
That's why a lot of diseases like sleep illness, like sleep apnea, periodic limb movement in sleep, could lead to diabetes.
Right. So.
So, I mean, not because of the high level of sugar, but because of
The
the
sleepiness.
It's the other way around.
Oh, it's the other way
So
around.
that's why in if I'm not mistaken, in 2006, International Diabetes Federation already mentioned something like every diabetes patient should check for their snoring.
Right. That's interesting. Okay.
Yeah. Because one of the causes of hypersomnia is snoring, sleep apnea.
Okay, okay, okay.
Because when you snore, that's snoring. But
Oh.
yeah.
that's sleep apnea.
Oh, so there's this difference.
Difference because
The way
sleep
they snore.
apnea, in Latin, pnea meaning breath. If we adding apnea meanings no breath. So no breathing during sleep.
Right.
Okay, so the patients snore, the airway collapse, and at one point it will collapse totally. So cannot breathe.
So, can it lead into to death?
Yeah.
Oh, okay.
So cannot breathe and then micro arousals, go back to sleep, not to wakefulness. So just arouse, sleep again, another episode of apnea, sleep again, micro arousals the whole night. That's what caused the hypersomnia.
Right.
Okay.
See, and then interrupted sleep. Yeah, of course, they have interrupted sleep. That will cause the metabolism disorder in the body. It triggers all kind of things like uric acid going up, cholesterol, especially the LDL, and then the blood sugar.
Okay, okay.
So snoring to diabetes, hypertension, heart problems, stroke.
Oh, wow. It's interesting to see that this is actually the other way around, doctor. Because we always think that because people snore, that's because they, that they don't have a good quality of sleep. And that also because they are having this GERD, like they having this diabetic, but actually the diabetic itself, it's the other way around.
Yeah.
But can it be cured?
How to cure it? First, we have to diagnose. Okay, we have to diagnose. It's not just the snoring. We have to diagnose not just do you have sleep apnea or not. No, not just that. We have to see the whole night. The oxygen levels, how many times you stop breathing during the night, right? And then how long and how is your heart affected. We have to see everything, then we decide what to do with the patient.
Okay.
For the time being, there are only 3 ways. Okay. Number 1, dental appliances. So a dentist make an appliance. So you have to use it at night. Okay. So your jaw something like this. Okay. Only at night, only for sleeping. The second one, we have to do surgery. Okay, on the palate, the base of the tongue, sometimes the nose, right? And then the last one is machine. We have continuous positive airway pressure. We have automated positive airway pressure. We have bi-level positive airway pressure. We have auto servo ventilation. So which one? Usually, patients goes through the golden standard treatment, actually the machines, the CPAP. Okay, yeah, but not all patients. We have to see every patient. So diagnosing is very important.
Before we go deeper to that diagnosis, I want to go back a little bit about the snoring because there's one's snoring and also sleep apnea that I get the information from you. So if one people or individual snores and which the snore is not sleep apnea, so is it okay to snore?
It's okay.
Okay. So,
It's
so
okay.
that's a normal thing to happen.
It's okay. It's okay.
Oh, okay. So when the snore becomes sleep apnea, that's something to
we have to
diagnose.
do something about it.
Oh, okay, I guess.
right.
So when, like I said earlier, that I think all of us, many of us, are not well informed about these sleep disorders, and I guess the first step to get a good help is with a good diagnosis. So when we go to you, maybe, what do you do first? You said that.
Of course,
to-
consultation.
Yeah.
I have to ask certain questions so I know what kind of sleep disorder. Then to diagnose, we go through the polysomnography. It's a
Okay.
sleep study.
Okay.
Yeah, sleep study nowadays is very modern. Back then, we have to do it in a lab with a machine, very huge machine like a cupboard, and everything is on paper.
Okay.
You know, like seismograph.
Yeah.
So the whole night I have to flip the paper, and in the
so
morning.
you cannot
Had
get some
sleepless.
sleep.
No. But now, wow, we can use the computers, the devices is very small. So now it's more wearable. Yeah. Of course, in my clinic we have a sleep lab. We have 2 rooms of sleep lab. So every night patients stay there, overnight there. But for patients that are, Indonesia is very big. Yeah, I can send the devices to them.
Okay.
They hook themselves up and then send it back to me, and I will analyze the data.
Interesting.
It's very easy now.
Easy, yes. Doctor, if I'm not mistaken, back then, a few years ago, you were known as the one and only doctor who are specialized in this sleep disorder. I don't know nowadays, but how do you see that people awareness of these sleep disorders in Indonesia as you are doing the practice of sleeping disorder?
More and more,
Okay.
especially in this economy, because people doesn't want to get sick, right? So preventive medicine is very people really concerned about their health, and this kind of smartwatches, smart ring, right? All of these devices, they have sleep tracking, and more and more patients are coming to me without a symptom. They just ask, why my deep sleep are very low? Why? Am I normal or something like that? I have hypertension. I want to be healthy, but why my sleep like this and this and that? So
the awareness is growing, I guess.
it's growing.
Yeah,
it's
because
growing.
me myself, I'm also wearing a smart band to identify my sleep. But this kind of devices, I guess, it's just a monitor for us.
Yes.
It doesn't give us any explanation or solution because it's not a doctor or not a human, right? So, and you said there was a machine called the
Polysomnography.
polysomnography. Can you tell us more about that? How can that machine identifies or can solve our problem?
Polysomnography. Poly meaning many. Somnus, sleeping.
Okay.
Graphene is recording. So
Okay.
we record many functions of the body at once, during the night.
Okay.
So like ECG for the heart, EEG for the brain, the breathing, saturation, everything, the whole night.
So that gives us a complete complete picture of how one sleep from the beginning until they
So
wake up.
by seeing their sleep, I know their health.
Okay. So that's how we can cure or maybe enhance our quality of sleep
Yes.
by doing that. Okay, that's good. Is there any? I mean, like, maybe. Well, I still do believe that it's not quite that many yet people that are aware of their health. Can you tell us lesser symptoms that are maybe common there out there, but people not aware of it? What can we take a look at? I mean, maybe it's what you said before, that if maybe your partner or your parent have snoring, but not that snoring, that sleep apnea snoring. What else? What lesser symptoms?
Like moving your leg, your limb.
Okay.
Yeah. So some people have insomnia. Okay. But most people think insomnia is only because of stress, problems, and etc., etc., etc. But some group of people cannot sleep due to their limb. We call it restless leg syndrome.
Okay.
Yeah. So these people, these patients, cannot sleep due to uncomfortable feeling on their legs. It could be like tingling sensation or pain, hot, warm, or even cold, but they cannot explain. It's just uncomfortable. Okay, and how to relieve? They have to massage, move. Some patients have to walk, and then feel okay. It's a relief. I will go to sleep. Another episode. So they cannot sleep. We call it restless leg syndrome.
Right.
So what's the cure for that?
Medication.
Okay.
Medication, we have to look into why, okay? Because it's very wide, from kidney failure, complication of diabetes, complication of herniated disc on the back, and as easy as lack of iron,
Okay.
folic acid.
Okay.
Right.
Yeah, so that's why sometimes a guy, a fitness guy, came to me. I have this restless leg syndrome, and okay, you know what's the prescription?
Yes. What's that?
Vitamins for pregnant ladies.
Oh, okay.
What's the correlation then?
Because
Yeah.
of the deficiency,
Okay.
deficiency of the
Vitamin D.
the iron, the
Iron.
folic acid, causing the restless leg syndrome.
Okay.
So I guess it's a whole package management of our body
Yes.
actually,
Yeah.
not just the sleep or not just
Yes.
making sure that we don't stress too much. It's a complex thing, I guess.
There is this
How about-
interrelations.
yeah.
Yes.
I want to ask too also, how about in our modern era right now? Because maybe like the last decades, screens are getting
Yeah, screen time.
bigger.
It's been increasing.
Yeah, and a lot of us, from the small kids until the elderly, they all have gadgets and also maybe working hours that are prolonged. Does
We
that
sleep
affect our sleep?
less. We
Yeah.
sleep less.
Why do you say that? We sleep less.
Yeah, because back in the early 2000s, Indonesians sleep like 7.2 hours per night. Now it's only 6.7. So we sleep less and less and less,
Right.
right? While the difference is in Australia, they still have 8 hours of sleep. I wonder why.
Oh wow. Maybe because
for-
of their working hours, they
Yeah.
don't start as early as ours.
And the school time, terrible. The school time in Indonesia is terrible.
It's too early.
Too early.
Too early. In other countries, most advanced countries, the school start time is like 8:30,
Okay.
9, we 7.
7.
Yeah,
6:30?
almost 7. Yeah, 6:30. I
6:30?
guess.
And we struggle
Oh
with
my
the
God.
traffic on the road at
Uh-huh.
6 a.m.
Yeah, so it's so many problems around that, because it's not only the sleep deprivation for the kids, for the teenagers. Not only that, it's not in line with their biological clock, with their biological circadian rhythm. If we recall during our high school days, yeah, any class at 7, we still like,
We're not there yet.
we are not there yet, but 9:30, okay, interesting. We are awake already,
Yeah.
right?
Right, that's right. But would you say that, come back to the previous questions, screen time would be
Screen
the
time.
major contribution to this,
Yes,
sleeplessness?
yes, because we are engaged too much. And of course, the lights.
The lights from the
The
gadgets.
lights, yeah,
Right.
because the blue lights, yeah, the brain will recognize the blue lights as daytime. That's why we sleep later and later and later.
Even if we make it in a dark mode?
Yes,
All right.
still.
Wow, interesting.
Okay. So it's interesting, getting more interesting, but we have to have another short break right now.
Okay.
Stay put, doctor. Many
I'll be
questions
here.
still.
Yes, still a lot of questions to ask.
We can talk about more about sleep later on. Don't go anywhere. Stay with us. We'll be right back after this short messages. Dr. Andreas talking about sleep disorders. Well, Dr. Andreas, I want to go back to our previous discussion that about screen time. I've heard from maybe also from social media again. I read from social media that we have to stop our screen time maybe like an hour or maybe 2 hours before we sleep. How do you see this?
Okay. Those scientists are true, okay? Because blue lights, our brain will recognize blue lights as a daytime.
Okay.
But the problem is now, when you cannot sleep, when you have insomnia, and you lie on your back, and you try to sleep, you look at the clock, you get more anxious, more anxious. I still cannot sleep. Where to sleep? Where to sleep? You get more and more anxious, more difficult to sleep. So actually, how for insomniac, I suggest, get your gadgets.
Oh,
Look your gadgets.
Look at your gadgets. Why? Because right now we don't have many tabloids, magazines. So if you do nothing, you get more anxious. It's more difficult for you to sleep. So I always suggest my patients develop a ritual as a sleep preparation. Okay. In order to sleep well, you need two things. Of course, you need sleepiness, okay? But you don't have to look for sleepiness. Sleepiness is always there. When it's time, okay? But another thing is relax. You have to be comfortable with yourself. You have to feel relaxed. Now, before bed, you have to relax yourself. How? The question is how? Meditate,
Okay.
breathing. It's not always work. Here's the formula. Do something that you really like that relax you,
Okay.
but different. So after wash your face, toothbrushing, okay, skincare, okay, and then you go to your bed and open your gadget. But I suggest different gadgets from the daytime.
Okay.
Okay, not-
That's the key.
That's the
Yeah,
key. Different. Okay, not working and everything. Just entertainment. You turn on the blue light screen. You darken the screen, and then you enjoy. You enjoy something that makes you relax, like podcast, and anything you like. If a guy, he likes automotive, you cannot
Don't go to the garage.
don't go to the garage, of course. Yeah, you can watch YouTube or something about the cars and everything. That will make you relax.
Okay.
Something
And then-
that doesn't make your brain
Yeah,
thinking.
yeah. For the ladies, probably. Oh, Just Tip. New
Shopping.
brand of
Shopping.
bags, purse.
Right.
Yeah, and then you enjoy. You feel relaxed, and the sleepiness is there. You put aside, you go to sleep. That's it.
Right, right.
So that's the key. So what I can take from your explanation now, so it's actually just the power of our will actually to get ready and find a way to get relaxed. If gadget can make you relax, use something different from your daily routine. So that's the key. You can take notes about that. But I want to also ask you, is there a specific group of age that is more prone to sleep disorder? Because
Yes.
I guess my kids don't have any problem sleeping.
The older you are, they said.
Nah.
No?
So please explain about
Your
it.
kids are not teenager then.
Yeah, they are 10.
See, because teenagers, young adults, they are the ones who are prone.
Oh, young
okay.
adults.
Young adults.
So around 13, starting 13?
Yeah, starting 13.
Right.
Okay.
What are the main cause for that? then?
Circadian rhythm. But they don't, the symptoms is insomnia.
Okay.
But actually what they have is delayed sleep phase.
Delayed
Delayed
sleep phase. Okay.
circadian rhythm disorder, delayed sleep phase type.
Please explain in
Yes.
So it's
human
easy.
language.
They complain of cannot sleep, difficulty of sleeping, but actually they can sleep.
Okay.
Okay.
But what time? They only sleep at 2 or at 3, and that's it. Why? Because of light, schedule, and everything. And their circadian rhythm normally gets sleepy around midnight.
Right.
Around it.
So
okay.
can you imagine a high schooler in college sleeping at midnight, has to wake at 5? Sleep deprived severely.
Right.
Okay?
So is that true then, doctor? They said that the older you are, for example, our parents perhaps, or our grandmother, grandfather, they sleep less than us.
Actually, the sleep needs the same, 7 to 9 hours, but the ability to sleep is less. A lot of light sleep, wake up at night, yeah, those kind of things.
So how can you improve, like for elderly and for teenagers? What can they do to improve their sleep?
For teenagers, kind of hard because if you can sleep at 2, kindly sleep at 2.
Okay.
Okay, make a certain schedule so you sleep at 2. Okay, and then from time to time, like 3 days, 4 days, move your sleeping schedules like 15 minutes every 2 or 3 nights. That's it.
So gradually
Gradually
moving your
move
time.
If failed, then it's time to go to the doctor.
Okay.
Yeah, we can prescribe melatonin at certain time. Yeah, not for insomnia. Yeah, melatonin is not for insomnia. It's for circadian rhythm disorder. So we have to prescribe at certain time, and then we have to do the bright light therapy.
Right. So, doctor, as our last questions, actually, can untreated sleep disorders or like these sleep disorders itself actually lead to the long-term health issues?
Oh, you name it. All these organs are failing with sleep deprivation, with sleep illness, heart problems, diabetes. And the recent survey, we find out that in Alzheimer, they have dementia, right? If you have untreated sleep apnea, if you are snoring, the dementia will arouse like 10 years earlier, something like that. So everything.
Right. And with that sleep disorder, with, for example, the snoring, do you actually perform surgery for that? For those people, surgery for those who are, having problem with their sleep and they snore, like the one that we talked about before.
Yeah, sometimes. But we have to do the sleep study. Yeah, we have to diagnose first.
Right.
Are you the right candidate for surgery or the other?
So there are various kinds of treatment for sleep disorder.
And the
people.
technology is still evolving. Like now, I heard that they are starting to have a medication for snoring. Isn't it very interesting? No medication before, but now we have 2.
What are those?
Zepbound, but Zepbound is actually not for snoring, it's for obesity. Because most of snorers are obese, right? And the other one is AD109. It's not yet released. It's aimed for the neuromuscular here, so open the airway. So you have to take it before bed.
So it's something you eat, or it is a treatment?
You eat.
Both of them?
Something you take.
Okay. So one last question. Finally, what is the top suggestion that you can give to our viewers to maybe enhance their quality of sleep?
Health is like this, okay? Health is like a triangle, okay? One side, exercise, of course.
Exercise.
Another side is nutritional balance, but the base, sleep health. Without sleep health, you exercise, you get sick. Without sleep health, all the nutrition and everything, you cannot get health. You cannot lose weight. It's difficult for people who are sleep deprived to lose weight.
Okay. So that's the 3
That's
keys.
it. So prioritize your sleep health.
That's very simple, actually.
Yes.
Have enough sleep, right?
Enough sleep.
And good quality sleep, right, doctors?
Well, there you go. If you want to know more, you can Google up Dr. Andreas Prasaja.
Prasaja.
You can contact him directly, I guess, because in our short time, we cannot talk more because we're limited by time also. It's unfortunate actually, but thank you very much, Dr. Andreas
Thank you very much,
Prasaja.
Thank you for
your
having
time
me
this
here.
morning. I think that our dialogue with Dr. Andreas, it's the end of our session this morning. Thank you very much for your time. I'm Sesko Satrio.
And I'm Stephanie Silitonga. Thanks for watching and see you next time.
Bye-bye.